My second story is about a bunch of engineers that like the Monongalia River, and some city council members as well. In 2008, they started approaching me because they were worried about the state of the river. And they were saying, you know what, things aren't right here. We're having power plants being shut down, and we think there is going to be a really big fish kill. Well, guess what? They were right. There was a really big fish kill. 22,000 fish dead. 14 species of mussels, some of them 80 years old in Dunkard Creek. And it's still kind of a mystery, but what we do know, there's been mining there for hundreds of years, but what we do know that is a big change has been fracking. And one of the things that fracking does is it has a byproduct of saline. And the saline in Dunkard Creek was the equivalent of seawater. And so these engineers that like to hang out on the Monongalia River and do fishing, that people that care about fish, now they're worrying about human beings. It's ridiculous that we only have 15 inspectors for thousands of wells. It's just ridiculous. Now, on the other hand, the only logical thing that we could do is to have a moratorium.
Resolution that we sent to the legislature and to the governor, all the committee chairs, basically indicating Lewisburg's concern as a regional water provider for the potential impact of proceeding with Marcellus shale fracking, hydraulic fracking, without any proper regulations in place. And without having any regulations in place, Lewisburg's stand, once again, unanimously, was to establish a moratorium on new development of that within the state until those regulations can be passed. People ask, why did you have much discussion? Was it a hot button issue? Basically, I commend my city council for basically treating it as, well, this is common sense. What's so hard to understand about that? We need to have regulations in place before we can proceed to develop this resource as we know it will be developed. But let's get it right this time. When industry points out and alleges that, oh, it's all, you've seen it in the papers, you've seen it in the media for the last few months. We'll self-regulate. It's, the DNR is in perfect condition to be able to, they've got enough inspectors, everything's working. I guess the key thing is to ask, how well do you think it really can work that way? When was the last time you saw industry agree to self-regulate and to put in regulations that would represent the people's interests as well? Never. If we make sure and we have our presence and we keep pushing for this thing, we will recognize that regulation can be put in place that will protect our interests. As anyone who's ever played in a poker game, when the people tell you, trust us, the idea is, yeah, you trust everybody, but you cut the cards. Make sure the regs are in place. Keep the pressure on.
As a physician, I think it's far better to prevent illness and public health disasters rather than to attempt to fix them after they're out of control. I speak to you as a conscripted, drafted service member in the Medical Corps in Vietnam, where I was myself exposed to dioxin. At that time, dioxin was not a known carcinogen. It was only one. Only now are we seeing the results, the past several decades, of birth defects in Vietnam and in servicemen's families who have returned who were exposed to Agent Orange and dioxin. Will the international crisis with fracturing with toxic chemicals be the next disaster? I have with me a paper that is going to be published in September this year in the International Journal of Human and Ecological Risk Assessment. This is not a paper that was supported by the oil and gas industry, and it was not supported by environmentalists. It was a study properly scientifically grounded by the School of Public Health at the University of Colorado. The title of it is Natural Gas Operations from a Public Health Perspective. If any of you would like to have a reference to this, we'd be glad to furnish it to you. It's also on West Virginia Forum website. I'm going to read you a portion of the abstract of this study. The technology to recover natural gas depends on undisclosed types of amounts of toxic chemicals. A list of 944 products containing 632 chemicals used during natural gas operations was compiled. Literature searches were conducted to determine potential health effects on the 353 chemicals identified by the Chemical Abstract Service. More than 75% of the chemicals could affect skin, eyes, and other sensory organs, and respiratory and gastrointestinal systems. Approximately 40 to 50% could affect the brain and nervous system, immune and cardiovascular systems, and kidneys. 37% could affect the endocrine system, and 25% could cause cancer and mutations. Do the numbers. Of the 623 known chemicals, this is only what is known because the gas industry is not disclosing what they are putting in the well. That's approximately 160 known carcinogens that has been used in the hydrofracturing process. These results indicate that many chemicals used during the fracturing and drilling stages of gas operations may have long-term health effects that are not immediately expressed. The corollary to that is that the people who will be making profits from Marcellus gas and hydrofracturing will not be themselves directly affected. As you know, most of these are out-of-state interests, but they could affect anybody living in hydrofracturing sites, including their children and grandchildren. Such things as cleft lip, cleft palate and a hair lip, spina bifida, neurological injuries, degenerative diseases of the brain. These are just a few. In addition, an example was provided of waste evaporation pit residuals that contain numerous chemicals from the Comprehensive Environmental Response and Compensation Liability and the Emergency Planning and Community Right to Know lists of hazardous substances. The discussion highlights the difficulty of developing effective water quality monitoring programs. To protect public health, we recommend full disclosure. Let me repeat, full disclosure of all the contents of the products, extensive air and water monitoring, coordinated environmental, human health studies, and regulation of fracturing under the U.S. Safe Drinking Water Act. This is not my opinion itself. It is my opinion that this should be done. This is a scientific paper, and these are the conclusions that they have published, or will be publishing in September. New York State has banned hydrofracturing in the Hudson River Valley because of the risk to New York City's water supply. Maryland has banned hydrofracturing in the mountain counties of western Maryland until more is learned. 3 communities in West Virginia have taken the initiative to regulate hydrofracturing in their communities. Our state legislature, our state government, has done nothing to date to comprehensively protect us and recognize our citizens' rights. Remember that what you can't see can hurt you.
And all around me, a voice was calling. This land was made for you and me. This land is your land. This land is my land.